are specific melanoma genes inherited from family history. Imagine a family where several members have had melanoma, a serious form of skin cancer. You might wonder if this pattern is just coincidence or if there's a genetic link. The truth is, some genes that increase the risk of melanoma can be inherited from family members. While most cases of melanoma are caused by sun exposure and environmental factors, about 10% of melanomas occur in families with inherited genetic changes, known as germline mutations. These mutations can be passed down from parents to children and can raise the risk of developing melanoma. One of the most well-known genes linked to inherited melanoma is called CDKN2A. This gene plays a role in controlling how cells age and divide. When there are mutations in CDKN2A, it can significantly increase the chance of melanoma, especially in families where multiple members are affected or where melanoma appears at a young age. Interestingly, mutations in this gene are also associated with a higher risk of other cancers, like pancreatic cancer. Another gene involved is called MYC1R. It influences skin pigmentation, such as hair and skin color, and can modify melanoma risk. People with certain variants of MYC1R tend to have fair skin, red hair, or freckles, which are also linked to higher melanoma risk. There is also CDK4, a gene less commonly associated with familial melanoma but still relevant. Inheritance of these genes usually follows an autosomal dominant pattern. This means that inheriting just one altered copy of the gene can increase the risk of melanoma. However, having a mutation does not mean a person will definitely develop melanoma. Environmental factors, especially ultraviolet radiation from the sun or tanning beds, play a crucial role in triggering the disease. Most melanomas happen sporadically, meaning they are caused mainly by sun damage rather than inherited genes. Families often share similar sun exposure habits, which can also contribute to melanoma risk, even without a genetic mutation. If you have a family history of melanoma, it's wise to consider genetic counseling. Testing for mutations like those in CDKN2A can help identify if you have an increased genetic risk. Regular skin checks with a dermatologist, including full-body exams and possibly dermoscopy or total body photography, are essential for early detection. Protecting your skin from UV rays by wearing sunscreen, seeking shade, and avoiding tanning beds is vital for everyone, especially those with a genetic predisposition. In summary, while specific melanoma genes like CDKN2A can be inherited and increase your risk, most melanomas are caused by environmental factors. Genetics and lifestyle work together to influence your overall risk. If your family has a history of melanoma, talking to a healthcare professional about genetic testing and maintaining vigilant skin health can make a big difference. Remember, understanding your risk is the first step toward protecting your skin and catching potential issues early.